This episode is brought to you by Dime Media. Love supporting local, but looking to save? I've got the solution. Introducing the 2025 CNY Women's Network Members Card. This is your passport to exclusive year-round savings at over 35 amazing women-owned businesses across Central New York. Whether you're grabbing coffee, booking a spa day, or shopping a local boutique, using your members card means more than just discounts. You're empowering women, strengthening small businesses, and building a thriving community one purchase at a time. Want to see all the offers and partner spots? Head to cnywomensnetwork.com/members-card or click the link in our bio. And here's the best part. Join the collective by CNY Women's Network and you'll get your members card free with your annual membership. More details at cnywomensnetwork.com/membership. Let's grow together, one card, one connection, one business at a time. Hello and welcome back to Cultivate CNY. I'm your host, Alex Canavan, and in today's episode, I couldn't be more excited to welcome Dr. Rebecca Alexander Carey. Dr. Rebecca brings a unique and deeply thoughtful approach to physical therapy, one that bridges science, movement, and mindfulness. With a specialty focus in pelvic rehabilitation and a strong background in orthopaedics, she's known for her holistic, patient-centered care. Her clinical expertise is grounded in advanced training in biomechanics and pain science and enriched by over a decade of teaching yoga, a practice that continues to inform her understanding of the body and its capacity to heal. Her work centers on the nuanced needs of pelvic health, fertility, oncology, and the care of female athletes, populations often underserved or misunderstood in traditional rehab models. Whether she's guiding a client through recovery or helping someone reconnect with their body after illness or injury, Dr. Rebecca's approach is rooted in compassion, precision, and the belief that healing happens on many levels. Outside the clinic, Rebecca is a lover of music, nature, art, and movement, and you'll find her painting, hiking, and practicing yoga, or simply just soaking in time with her family. She loves to stay connected to the things that ground and inspire her. In this episode, we explore Rebecca's path into pelvic health, how yoga and science intersect in her practice, and why true healing is never just physical, it's personal too. So, without further ado, let's get right into it. Dr. Rebecca Alexander Carey, welcome to Cultivate CNY. It's an absolute pleasure to have you on. I'm really excited for today's conversation. We're going to talk a lot about the pelvic floor, what that is, what it means, and how we can make it a priority, especially for the women in our audience. It's a very important part of living a quality life. Would you say?
Yes. Yeah, very important.
We're going to do a really amazing pre-recorded intro. People will know who you are, but I would love to know what made you fuse yoga and physical therapy together.
Thank you for asking that. So in 2012, I was living and working in New York City, and I had a job as a hospital administrator, and I was running a blood donor program. And I would say I was a 20-something that it was a little bit like lost in a sense of not sure exactly what I was going to do with, in terms of profession and career. And one morning at about 4 a.m., I woke up and I just got this overwhelming dizziness. So woke up out of bed. It felt like I had the spins, if anyone's ever had those before. And I couldn't walk. I had to crawl to the bathroom. I thought I had a stomach bug or something like that. Turns out it was a viral infection or a virus to one of the nerves in my vestibular system. So thankfully, totally benign, but I had never been so sick. And so that was a huge, I think of it as a divining rod moment in my life, where if you know a divining rod, you take hold of the two sides and it kind of drives you in different directions. That was a huge life changing moment. When I had that happen, I then went to the hospital the next day. I wasn't sure what was going on. Started to resolve, but I had to walk with a cane for about 2 weeks because I was so dizzy. I would just like fall over, lose my balance. Very healthy 25-year-old otherwise. So that was a huge scare for me. Again, I was completely fine, but at that moment, I said to myself, what is going on here? B, is this like a sign from whatever higher power or something? And then what came after that, in terms of the healing that took place, I went to physical therapy. I was assigned to go to physical therapy for vestibular rehab. And at the same time, my very vigorous, rigorous gym and running routine was totally altered because I couldn't do those things.
Do you think
Someone,
this
Mhm.
sign was like a sign to reflect on how you were living your
Yes,
life and what your
yes,
lifestyle was?
exactly.
What was your lifestyle like?
Exactly. It was not a lot of, self-focused care, it was really, like, unintentionally, I would drink coffee and then go to work and not eat, sometimes till lunch. I just wasn't really thinking about it, wasn't even intentional, so I was probably undernourishing, probably over, like, working out and just not really taking time to reflect for myself and do things that, promoted more wellness. So thankfully, and I look at it as such a blessing that I started practicing yoga and I attended physical therapy. And between those two things, I could not believe how much better I felt after I went to yoga classes. I had attended some when I was at Binghamton University, and I would often leave before Shavasana, which is the relaxation at the
Yeah,
end, because I
which
would
is so
say, I already
sacred.
stretched out. I don't need
Yeah.
to
Oh
stay for this
gosh.
last part.
That tells me exactly who you were.
Oh, yes, 100%. And then I started practicing, or I decided on practicing physical therapy because I could not believe how the clinician who I was working with impacted and helped me heal so much. So I said, this is exactly what I want to do. So those two were really birthed together. And so that's a huge part of why I'm sitting with you here today.
I mean, that's incredible, first of all. I'm a huge lover of yoga, and I have found that, especially as my career gets harder and busier, it really is some of the only time that I get to spend in my head. And being someone who loves to be active and move my body, I've dabbled a little bit in seated meditations. Yoga has its way of putting you into your body, and giving you that space to work through things. How do you feel about that? Do you think that there's something to that, through physical exercise and movement and the healing properties of that?
Yeah, absolutely. So in yoga, there's I talk about different hats that I could put on, but if I put on my yoga teacher hat, there's different energies that are within our body. So for some, when we think of things like anxiety or being kind of overstimulated or feeling like foggy, kind of cloudy brain, that's usually when our energy is too high. So it's almost like if you think of the chakras or there's koshas, and these are all like more in the yoga realm of things, but where our energy is up. Usually, to balance that out, we need to bring it back down. And so, yoga does a really good job of that, of keeping ourselves in our bodies and grounding. If someone is experiencing anxiety or anything like that, or overstimulated, like in our world, it's very,
Yeah,
very easy to feel that
with the
way.
horns going off left and right.
So, staying in our bodies can be really uncomfortable and but very important. So, and especially for people who have experienced trauma, or like assault and things like that. Sometimes even if our bodies just hurt, right? If there's discomfort, staying in our body can be really hard. But embodiment is one of the most important things. It keeps us in our literally in our physicality, and it's a great grounding exercise.
I love it. I also am a fan of breath work too. As
Yes. That's
a
another great way to get in your body too. Yeah.
Yeah, because I mean, it sounds like, when you were 25 and you were hit with this infection, it sounded like you were a high performer. Just
Yeah.
like
Mhm.
most of us, getting up, getting after it. You
Mhm.
don't think you're doing anything wrong because you're
Mm-mm.
staying productive.
Mhm.
And by society's terms, you are successful, and that's all that
Mhm.
matters.
I ate healthy. I did all of the things I was supposed to do. I exercised, went to sleep at a reasonable hour. I was like, wait, this doesn't compute. None of this calculates. It doesn't make any sense. And so, but I look at it as such a gift that happened because I probably would still be kind of grinding in the same way if it hadn't. So I think at first I looked at it as almost, to really get deep into it, but almost like a body betrayal. Like, why did this happen to me? I thought I was doing everything, the right way. And then now I really see that that happened in order for me to discover all these wonderful things and to make a left turn in my life that I'm so grateful for.
That's really incredible that you're able to reframe that and do something positive with it and continue to move forward. I think like when crazy things happen to our health,
Mhm.
there is a level of betrayal that you feel from your body.
Yeah.
And so I know that you don't just specialize in yoga and the intersection of yoga and physical therapy, but you talk a lot about pelvic health.
Mhm.
So if no one has even had a conversation about pelvic health, what does pelvic health mean?
That's a great question. So you mentioned before also, uh, the pelvic floor is someone that everyone has also. So women, men, anywhere in between, children, right? Like everyone has a pelvic floor. What these muscles are the ones that govern our control of our bladder, bowel, and all sexual function as well. The easiest way to describe what place it's at is like if someone's sitting on a bike seat, the muscles that are underneath that space, or like sitting on a saddle, kind of the saddle area. So these muscles are skeletal, meaning that we have control over them. So if we need to get to the bathroom in time, we can kind of squeeze those muscles. Most people do it automatically, squeeze them up in order to get there in time. There's different things that can happen where that's difficult for people, and sometimes they squeeze too much, which is then another element that we need to work on. But in terms of having wellness in this area, it's being able to control what they do and when. And there's nothing that happens that you don't want to happen, and everything that you want to happen is able to happen, if that
Yeah,
makes sense. That's really like the easiest way to put it.
definitely helping
Yeah.
people's quality of life. I mean,
Yes.
it's these little things that none of us think about, especially when we're healthy,
Hmm.
that are a problem for a lot more people than you'd think.
Hmm.
So, how does pelvic floor dysfunction manifest? And what signs should people look out for?
It can manifest sometimes over a lifetime. I see many patients and clients. I've spoken to many people after I do talks and things like that as well who say, I think I've always had a small bladder. Sometimes I'll hear where I always have to pee a lot. I always wake up in the middle of the night to go to the bathroom like a million times. Um, it manifests sometimes just what we call insidiously, which is just completely on its own, or idiopathically, where there's really no reason. That's very common. Sometimes it'll happen after someone has a UTI or someone has bacterial vaginosis, yeast infection. There's different kinds of cancers that it's often associated with, so prostate cancer, even bladder, bowel cancer, colon cancer, and things like that, which of course then there's radiation, sometimes different medications that are involved. Even if someone is perfectly healthy otherwise, right, they could still have different things that are happening within their urinary system. So if someone is, let's say, pushing their pee out, which is also very common, we call it like the power pee, or like the
Yeah,
power push. And I hear it all the time in public bathrooms, and I want to be like, don't push your pee out, girlfriend. But that happens a lot where you
because
hear
people are in a
that.
hurry.
They're
Do
in a hurry,
yeah,
but the muscles shouldn't be used that way because 'cause you're just squeezing your bladder. And then constipation. I mean, there's a lot
yeah,
of different things, but all those things are treatable, by pelvic floor physical therapists and pelvic floor specialists. I don't think it's known about though, so.
yeah. It's definitely
Mhm.
not talked about enough.
No. Mm-mm.
Um, I am chronically online and I specifically feel like I'm definitely on the wellness side of TikTok. So I'm always being served content that's very trendy in the wellness space
Mhm.
and hearing all these different terms that are trendy. And people have, for the past couple years, I think people have been loving the discussion around pelvic floor
Mhm.
exercises and
Mhm.
strengthening your pelvic floor. And of course, a large part of this virality, I think, is because of the aesthetic benefits that it serves.
Mhm.
Strengthening your deep core is,
Mhm.
especially after women have children,
Mhm. Yeah.
is extremely beneficial. which I'm sure we'll get into all that good
Yeah.
stuff too, because I'm sure that's also how yoga can play a part too.
Mhm.
What are some common misconceptions that you hear about just pelvic floor health in general?
I would say the most common one that I hear all the time is that Kegels are the number one thing to do when it comes to the pelvic floor. Oftentimes, the Kegel, which is an engagement or a strengthening or a squeezing of the pelvic floor muscles, is typically not where someone needs to start. It's common that most people think my pelvic floor must be weak. I'm having these symptoms. Not always the case. I've worked with lots of individuals who have too much tension. So think of
Yeah.
like their body's already in a Kegel, their pelvic floor
Mhm.
is already Kegeling
And they're
24/7.
are they, like, usually constipated?
Or they're having incontinence, so that can
Okay.
also be associated with if the muscles are too short or too tight, you can still have leakage. It's interesting because if you go on Doctor Google, you're looking things up. If I have incontinence, oh, I must need to do Kegels. I'm not doing enough Kegels. So I see also a lot of like that cycle where then people get so hard on themselves. I'm still
They
having these symptoms. I
blaming
know what I need to
themselves.
do. And then meanwhile, they don't know that what they're doing is literally the opposite of what they need to be doing. So I would say that that's probably the number one misconception is that Kegels are the answer or the cure all for all pelvic floor stuff. Not always the case. Some other things that I hear very commonly are that the pelvic floor muscles are very easy to engage. So oftentimes when I do examinations and things, people usually will use other muscles and they squeeze those and they say, "I'm doing it right. I'm doing a Kegel or I'm squeezing my pelvic floor," but it's like their glutes or it's another area that is has nothing to do with the pelvic floor. So that's all good and fine too. And, I note that information. Okay, try this. Nope. Okay, we'll come back to that. We're going to work on re engaging these muscles. Sometimes it's a matter of just finding where they are and understanding, that brain body muscle connection, right? If you've never thought to engage your left elbow, it's going to be really hard to pick something up because you don't know how to use that muscle. With these muscles in particular, most people don't really think about using them unless they're having a problem or they're toilet training. So again, that's another aspect of things is for people who are born with a uterus and have cycles every month and all of that, or have children, they have a little bit more of like a relationship with their pelvic floor. So it can almost be a little bit easier in a sense because they're getting a cycle typically every month. Maybe they had a baby and then they are now having, symptoms or had symptoms and they went away for individuals who are not born with a uterus and individuals who have prostate. So, like if they have prostate cancer or something like that, or having erectile dysfunction, urinary incontinence, or any difficulty in that area, they usually have a much harder time getting comfortable with engaging these muscles or knowing how to relax them. So, I've worked with individuals also, mostly in my work through Upstate Medical University, where there's many patients who have trans surgeries, so gender affirming surgeries. And that's also very interesting because you're still working with the same muscles, but they're just functioning in different ways.
Yeah, you've worked with a wide range of clients, and I think that a lot of people that aren't super versed in pelvic health just assume that your services or these things are really only for women,
Hmm.
but everyone has a pelvis, like you said.
Yes.
I'm just curious. I know that you're into philosophy and you like to get a little
Yes.
philosophical. And there's always I'm, you know, never one to push spirituality, but I always feel like there's some sort of emotional or soul tie to
Hmm.
the manifestations that the physical body has. You know the saying, when there is dis-ease,
Hmm.
that's when there's disease, right?
Hmm.
And I know that the pelvic area, the womb area for women at least, is a very important area,
Hmm.
especially when it comes if a woman is experiencing any sort of issues in that area
Yeah.
or pain. A lot of emotions get stored in the
Hmm.
hips,
Hmm.
and I think just having like a background in dance and being into yoga for so
Mhm.
long, I feel like I'm really fortunate to just be aware it's important to open the hips and
Mhm.
stretch the hips and release that tension.
Mhm.
Um, but I've had my fair share of hip pain at certain times, and it's never a matter of what's wrong with my body. It's like, what's wrong with my life? Like, what is going on with me
Mhm.
emotionally?
Mhm.
Because I know a lot of that does that tension that we're holding in the hip area
Mhm.
usually is tied to some sort of emotional issue. So I'm just curious what your thoughts are on that. If maybe you have had an experience with a client, maybe a little bit more of a closer client that you're able to have conversations like this with.
Mhm.
Has spiritual health played a role in your
Mhm.
work?
That's a great question. So, um, when we think if I put my yoga teacher hat on, and really I love to blend the 2, so thank you for asking
Yes.
me this.
Like the chakras. Yeah,
Absolutely. So the
it's
root
huge.
chakra, I've done a number of workshops on it, and so I've like really deep dived into this subject. So the root chakra is the first one to develop. It develops like in each person. So when you're in your mom's abdomen, it starts developing. The root chakra is at the perineum, so it's right at the pelvic floor area, and it has to do with trust, safety, and, of course, if there's anything going on sexually in someone's past or in someone's current life and lifestyle, those things all play in. But really, trust and safety, security are the other elements there as well. So I think of it as it's the first one to develop, meaning that if we have that safety, security in our life and in our world experience, from I think it's womb to 18 months, right? Then we're kind of that's how our root chakra develops, right? So let's say that we had a lot of like changes during that time before we were like a year and a half, then it could be a lifelong thing where someone might have just a little bit of imbalance kind of at baseline of their root chakra. Um, the thing is that when we think about different somatic, which is kind of some of what you're talking about, different somatic or psychosomatic elements of like our physical body and our energy body, there's so many things that we can't measure and we can't see. We can't, and we'll never likely be able to measure these things. That's the nature of them. That being said, with the root chakra, when we think about different symptoms and things that might come into play, it looks like that lack of trust, lack of security, lack of stability. So if someone is like kind of always spun out, they're not rooted anywhere, they're always changing, let's say like changing jobs or changing careers, or they can't stay in one place at the same time, can't stay in the one relationship for any period of time. That's not always having to do with the root chakra, but that's an element that someone might want to look at if that is kind of like what their life has been, if they're reflecting on that. And then physically, of course, it's very interesting because in the clinical work, when we work with the pelvic floor, there is some external and internal work that's involved. And so, as a clinician in trainings, it's often said that you listen to the patient's words and you also listen to their body language. So, I've worked with a lot of individuals who will be saying, yes, I consent to this exam. Yes, I consent to this treatment. And their body is saying, no, don't do this. So then it takes, and it takes practice too. I've been doing this for a number of years. I haven't been doing it for 40 years. I'm sure that if we spoke then, my approach might be a little bit different. But for now, I allow, the person makes their own decision about what's happening to their body, number one. And any treatment is for them, right? It's never something that we have to do. It's never something where you don't have a choice. It's always they're in the driver's seat. But that being said, it's also really important, for us, for myself as a clinician, to get that okay from their body too. So that's often what I see for the most part when I kind of tune in like my antennas to see what am I picking up on? What's the vibe of this patient right now? Is it appropriate to be doing this treatment or performing this exam?
If someone is not sure if they actually have an issue with their pelvic health, but they think they might, What would you suggest their first step should be? Should they ask for help or should they maybe do a little bit of exploration first?
Yeah, I love both options. So if someone is really not sure and they are like, I don't really want to look down there. I don't want to feel down there. I would say breath is always like the number one way to get access to any part of your body, right? So lying on your back with the knees bent, one hand between the belly button and the pubic bone, place your hand on your low belly. Try to do some diaphragmatic breaths, breathing in, breathing out. You usually will get a little bit of access to the pelvic floor that way. So someone can try to do some deep belly breaths. And then just because of the proximity, you can often get a little bit of some breath into that area. If someone's comfortable with taking like a mirror, you can take a mirror down there, look without underwear or with underwear, and just see what are the pelvic floor muscles doing. Can I squeeze them up? Does nothing happen? Am I able to access them at all? And so that's another way. If somebody does not want to really look in that area, contacting a clinician would really be best. But I see a lot of patients now more than I have before who literally reach out because they say, I don't know what's going on with my pelvic floor. I really don't have any symptoms, but at some point in my life, I'm going to go through menopause. Some point I might have children and I just want to see what's the state of my pelvic floor. That's also a great reason to make an appointment too.
Do you think people are starting to be much more proactive around things like
Yes.
that?
Yeah.
That's great.
Yeah, and honestly, I would love to say that it's like I think a part of it is the consciousness is rising
Yeah.
in general in Central New York about this. The other piece that I love, and I just Daryl Young and Sharon Riccio are two mentors of mine who I like to say like lovingly guided me into this niche area of practice, and some clinicians at Upstate as well. But they worked tirelessly doing lots of grand rounds, lots of education, speaking, advocacy to try to drive that train for so long, for decades. So for us to now be kind of like, we're seeing that these plants are popping up. Well, who planted the seeds? So, a lot of that was going on well before we're now having these conversations. So, kudos to them. And also just like, it's fantastic that it's happening.
Yeah,
Yeah.
it's really great. Especially I just love that we're having more conversations about menopause and perimenopause.
Yes. Yes.
Um I just don't know why it hasn't been talked about until now, and maybe because there's just more access to just people having platforms now and
Mhm.
talking about it, but
Mhm.
I think it's funny how mainstream media before never covered it, right?
Yes. Yes. There's also there's been some more like research that's come out.
Yeah.
So I think in some ways too, some of like the people that really need like that concrete, well, is there evidence? Like we were talking about psychosomatics, like, is there evidence or it's just, for so long for like decades, right? If a woman had menstrual cramps, it was like whatever's going on in that region, doctors would just say, you probably have PCOS, you probably have, endometriosis. And it just kind of got dismissed in so many ways. That now it's finally getting addressed in a little bit of different ways. I've seen many patients who have gotten that kind of, I think of it as like a kitchen sink diagnosis. You likely have PCOS, you likely have, um, endo without actually getting the proper test to see if they truly have it. And then they start working with myself or another clinician, pelvic floor PT, and their symptoms resolve, their pain improves. And, was it the musculature or was it actually that they had something medical going on?
Mhm.
So
Yeah.
sometimes it's both, sometimes it's one or the other.
Yeah. That's I'm glad it's starting to change cuz
Yeah.
getting a diagnosis that's not yours is terrifying.
Yes. Yeah, very true.
What advice would you have for people that are looking to improve their pelvic health or at least their pelvic floor muscles outside of a professional's
Mhm.
office? How can they
Mhm.
do it from home or at least
Great.
maintain them?
Yeah, so starting with breathing, really breathing. Diaphragmatic breathing is can't say enough about it. It helps the pelvic floor muscles to relax. So if there is any tension,
And when you say diaphragmatic
mhm,
breathing, where is that happening? I mean, obviously the diaphragm,
yeah.
but
Yeah.
Could you explain it a little bit more?
Yeah, sure. So the respiratory diaphragm sits like, so if you kind of poke around your ribs, right at that bottom part of your ribs, and it goes all the way around. So it even attaches to your spine too. So I love the 360-degree breath. So if someone were to take like a strap, like a yoga strap, or any belt or anything like that, put it around their ribs, and then you could kind of cross it over. So you're holding on to the two ends and try to breathe 360 degrees into your rib cage. Then you're really breathing with the diaphragm. What diaphragmatic breathing helps so much with is because the respiratory diaphragm and the pelvic floor is also a diaphragm. These two are parallel. So they're parallel in the body for a reason, because when we cough, we sneeze, pressure changes. The pelvic floor typically should do what the respiratory diaphragm is doing. So when we cough and we sneeze, the diaphragm, many people don't know this. But the respiratory diaphragm goes up, and it actually helps our lungs to push content out. So like if we go to have a forceful cough, that's all your diaphragm is just pushing up really fast to help the lungs get rid of what's in them. The pelvic floor should also lift at the same time. So that's why if someone has lost contact with these two, like when people cough and sneeze or they jump, the respiratory diaphragm is going up and the pelvic floor sometimes is pushing out if they have incontinence, if they have leaking and things like that. That's like a loss of the coordination of these two muscles. So diaphragmatic breathing, that's why it's number one, not only because I practice and teach yoga, but because the connection here is so important. Diaphragmatic breathing, number one. Number two is using a mirror. A hand mirror can be really good just to see what's going on down in that area. Can I squeeze the muscles in? Can I push them out? If we're looking at, can I pull this up?
Oh, yeah,
Okay.
yeah. Let's see this lovely
This is the female pelvis.
there she is
This is
in
the
all her
female
glory.
pelvis. Yes, she is. So the different structures that are here, I'll just point them out quickly and then I'll explain what this is relevant here. The little yellow there is the clitoris, and then the urethra is that tiny little hole there, the vaginal opening, the perineum, and then the rectum. The perineum being right here. So if someone is doing like a self-exam with a mirror, and they want to hold the mirror like right here, they want to see, can the perineum pull up and in? Does it move inward toward the body? Does it push out? Does nothing happen to it? Watching the perineum can be the most helpful aspect to see. The muscles should act almost like a parachute. So if they can kind of lengthen down and then pull up and in. So that would be another great like at home way that people kind of could access and get more health in this area.
Yeah, just to check up
Yeah.
on it. And if you're a woman
Yeah.
and you've never grabbed a hand mirror,
I
here's
love
your
that.
sign to do
I love that.
it.
And then the other thing too, I have to say, bladder health, bowel health, do not push or strain. Nothing should be forced out of the body. It should just come out on its own using a squatty potty. I don't have stocks in it yet. But you should use like a stool or something under your
If
feet.
you're having trouble
Yes.
going.
No, in general,
Oh,
everybody
okay.
should. Yeah, everybody should.
Why is
And
that?
because it actually helps the angle of the pelvic floor so that the rectum is not positioned like forward.
Okay.
Yep.
Okay. Good to know. I guess I
And
need to
then
get a squatty potty.
drinking enough water, have
Yeah.
your body weight in ounces every day of water, and avoiding like bladder irritants. So that's like sodas and tons of coffee and all that kind of stuff. Some people feel irritation when they pee and that kind of thing. But again, these things are not things people have to live with.
That was amazing. We're gonna, I hope everybody learned something from that. Very important information. But I would love to know more about you, Rebecca. You're involved with a lot of amazing local institutions here, like Crouse Health, Upstate Medical University, Syracuse University. What are you doing to help healthcare workers right now?
So next weekend, actually, well, May 16th, 17th, I'm going to be leading a yoga for healthcare staff well-being.
That's
The
so important.
first of its kind. Yeah, Central New York has not done anything like this before, where it's actually using myself and there's a psychiatrist also, Dr. Nayla Corey. We will be co-leading this 2-day workshop focused on assisting healthcare staff to better develop grounding strategies and self-care strategies that they could use during the day as they're practicing in their clinical roles, even non-clinical roles. We have a lot of clinicians and non-clinicians alike. Most of this idea was actually born out of some of the work that I've done in terms of mentoring and working with medical students and other healthcare students at Upstate Medical University. A large part of that had to do with my own experience as a new practicing clinician for how am I going to ground myself and prepare myself for this situation that I know I'm stepping into. This individual just got a diagnosis of X, Y, and Z. I'm going to be here to ask them to do all these things as a physical therapist: stand up, walk around. They're going to be in pain. How will I manage my own emotions while I'm also working with them for their betterment and, make it so that it's a positive experience for everyone? So that really that's where it was born. And so the work that I'm doing with the individuals who are attending this workshop is going to be surrounding that. So we'll give a lot of the evidence, the benefits for yoga, and then we're also going to be doing a little bit of powwow, talking about case studies, and a large part of it is also going to be to focus on how do we generate and embody empathy. And actually, embodiment, like you mentioned before, about staying in the body, is a huge part of grounding work for healthcare staff. And especially for anyone who works in a role where they're opposite facing someone else who's going through some stuff. That is a huge element of it, is how do you stay in your own body while this person's also experiencing their own things right next to you, and you're trying to help them at the same time.
Talk about a balancing act, right? It's like, how do you stay empathetic and,
Yes.
be the person that that patient needs while also protecting your energy, your mental health.
Yes.
What better time to do this than during Mental Health Awareness Month?
Yes.
We actually just one of our newest members came from nursing, and she
Wow.
was, the past 5 years have been long for healthcare workers. I
Yeah.
mean, no
Yes.
joke, but she was in the ICU during COVID, very
Mhm.
high stress environment, and she got burnt out and she left healthcare. She's looking for her next opportunity, but it's we have a commute, particularly in central New York, because of the amazing hospitals and
Mhm.
institutions here. We do have a community full of healthcare workers that need more resources like
Mhm.
this,
Mhm.
and just more people like you that are there to support them. So I love that you're doing this. This is the Upstate Yoga Program. Is that correct? Or is there a
Uh,
specific name for it?
so it's yoga for healthcare well-being.
Yoga for
Yeah.
healthcare
Yep.
well-being.
Mhm.
And do you plan on doing this more than once?
I do. Yes. So it pending approval, of course, by the organization. We are doing pre and post surveys. So we're looking to see, in terms of burnout, resilience. So we're using a couple of different measures that get used internationally to see if we're able to move the ledger slightly. And we're hopefully, because a part of the training encompasses also creating your own plan. So everyone will create their own plan, kind of like their own self-care plan. It doesn't have to be anything lofty or crazy. That's the other piece too that I can't wait to discuss with these professionals next week, is just to express that we're not looking for you to completely, take a week off every 6 months where you need to do this intensive program. It's really 5 minutes a day, it's 10 minutes a day, it's 5 minutes here and 15 minutes here. Where can you take a little bit of time to find your feet in your shoes, pushing your toes down, find your breath, take a few intentional breaths, and do this throughout the day, because that really does help our body to be able to remain compassionate, empathetic, and to keep some of these things in a healthier and more of a wellness focused way so we can do our work and
Yeah.
still feel like a human,
Oh
you
yeah,
know?
I
Yeah.
was just about to say, like, I feel like this these are the things that are needed to maintain your humanity when you are in a role that
100%.
is so demanding,
Mhm.
so high stakes, so stressful, traumatic. I mean, the things that you're seeing and taking on and carrying.
Mhm.
The member that I just referred to, she was telling me about how a lot of nurses, in her role, like they usually do because of the high stress environment. And the fast pace of it and the demanding hours, there really is no time to process
Mhm.
a lot of things.
Mhm.
So a lot of them resort to dissociation
Mhm.
and will usually do that through, various coping mechanisms that are not at all
Mhm.
serving their
Mhm.
mental health or them at all. And there's like a lot of addiction that
Mhm.
happens in that industry, I think.
Mhm.
Long hours,
Mhm.
no sleep. It's just the perfect environment for disaster. So,
Mhm.
yeah, I'm sure that like having these tools that they can integrate just into their daily life
Mhm.
will be huge. So,
Yeah, and even just something like dissociation, that's exhausting, right?
it's like your life will pass you by. You don't
Your
want
life will
that.
pass you
You're
by,
doing important work
and
and
then from a physiological standpoint, your body is just it's just
a machine.
adrenaline, cortisol, it's just all day, which is not great for your tissues, right? It's not good for longevity, it's not good for anybody. Of course, there's many layers to what's going on in healthcare in general. That's a whole other subject we could have a whole other episode on. But that being said, especially with nursing or with people who are like clinic focused, patient facing, there were different things that have been recommended to me over the years, and in particular, Kaushal Nanavati, who's a family medicine doctor and does integrative medicine at Upstate Cancer Center. He was a mentor of mine, still is. We spoke at length about, well, how do I remain in my body, not dissociate, right, and stay present and focused. That's been also a journey of my own too, as I went through schooling and becoming a clinician. There's different things that work for different people, but for me, I imagine myself as a column of just white light. And so anything that's coming my way, it just kind of reflects and emanates back out. Nothing actually comes in. But I've heard clinicians say that when things come in toward them, they process it and then let it go. That seems exhausting too.
That's a lot of work.
So, I mean, different clinicians handle it in different ways. And I think even someone who's not, in a clinical role, they're also having to process these things too, right? Someone who's checking patients in is still working with people who are in pain and maybe they're irritated that their appointment has changed or something like that. So there's a lot that's there. Being able to have some of these grounding strategies where you can stay in your body, feel good in your body, and stay present with the work that you're doing and not feel burnt out. That's the goal of this training.
Yeah, I'm so excited to hear how it goes, and I'll be looking
Me
forward to that. You said
too.
May 16th and 17th?
Yes, it is. Yep.
Okay, great.
Mhm.
And then on June 7th and 8th, we have the first pelvic floor yoga teacher training
That's
in
right.
Central New York
That's
happening.
right. Yeah.
Very
Yep.
exciting. What made you wanna do that?
Yep. So I've been teaching about the pelvic floor in the yoga space since 2016. So when I was in physical therapy school and I started learning about the pelvic floor and pelvic health, and again, I mentioned several clinicians lovingly recruited me to the world of pelvic health. A big part of that had to do with that I had a background in yoga when I was a student at Upstate for physical therapy. But when I looked around, both as a clinician and in the yoga space as well, seeing how many people could benefit, how many students could potentially benefit. We have a lot of really wonderful yoga instructors in this area, but not everyone is really incorporating much about the pelvic floor. I'll hear it incorporated sometimes in classes where engage Mula Bandha or squeeze your pelvic floor muscles up. But then I always have that little bit of a caveat in the back of my mind. Well, is that really appropriate for everyone to be doing? And like knowing when to cue that, when not to cue that. Um, yoga's origins also, right, like look very different. So a lot of yoga was created for males. And so like in India when it was like first created, so the Mula Bandha, I think even when I've seen patients who practice yoga and they're engaging Mula Bandha, sometimes their bodies, right, the pelvic floors are different. Not everybody's body should be doing a Mula Bandha all the time. And it also depends on how it's done, right? I mentioned before too that sometimes people think they're engaging the pelvic floor, but they're actually not, right? So that's its own journey in and of itself. So I think that that is really the ultimate benefit is how can we teach more yoga teachers how to use and cue for pelvic floor health, optimal pelvic floor health. How do we know how to specifically tailor classes for different individuals having different symptoms if they share anything with teachers? Because as a yoga teacher, you hear a lot of different things. I got this going on. I got this going on. You know,
Everyone's
people
there
have
for their own
different things.
reason.
Yes,
A lot of
exactly.
reasons to go
And
to
the more
yoga.
you talk to students, you hear it all. And then there's the other element as well, which has always been a dream of mine too, that I'm hoping to do more of, is to train clinicians as well. So there's many clinicians who are also wonderful and skilled in the realm of pelvic health in central New York, but not all of them have a background in yoga. So I'm really looking to marry these two with this training to help yoga teachers to be able to access and use pelvic floor cues in a better way, and also to help clinicians. How do you teach yoga practices to your patients so that it's effective in terms of helping them with their pelvic health?
Oh my gosh, so you wanna just marry the 2 and then
Yes.
I mean, I can see why. I'm sure that, patients that come to you that have been practicing yoga maybe, are able to pick things up a little quicker,
Yes.
right? So I'm sure that
Yes.
yoga in general is a productive use of people's times
Yeah.
especially if they're looking to improve their pelvic health.
Mhm, mhm. The breath, you mentioned before too, even with the hips, the
Mhm.
attachment of the hip muscles right to the pelvic floor and pelvic area. The thing is, I think of it like an ecosystem down there.
Yeah.
And so if one thing is like slightly off, right? If somebody's, let's say they're like their bladder is slightly off, it hurts when they pee. There's other parts of the body that can start to be affected. Maybe they start getting crampy or different things like that, or their hip, they might start getting hip pain. The pelvic floor is like this. I read this meme recently and I was like, I'm sad for moms everywhere, but also it was that the pelvic floor is like the mom of the body because it'll just like pick up all the extra work like that needs to be done in like the household of your body. But when we think of things like someone who, let's say, has little to no hip strength, like how are they even walking around? They have no hip strength. And usually I see this in older women, individuals. Their pelvic floor will just start to become overactive because the pelvic floor is working anyway to try to help you get to the bathroom in time and hold it in so you don't have an accident. It just starts to do all the work to stabilize your pelvis as well. So when you're walking around and all that too.
Yeah, is that
There's
why
so much there.
well, does the core play into a lot? Usually the core is very connected to
Yes.
the pelvic floor, right? So
Yes.
the weaker our
That's
core
right.
is, usually for me,
Mhm.
my core in general, I've always just been hyper aware of what's wrong with my anatomy
Mm,
essentially,
mm,
but I have knock knees, so
mm,
and I've
mhm,
never had a super strong core.
mhm.
So the knock knees, the loose core has like always created a lot of lower back pain for me.
Mhm.
But the more I've made it an effort to, increase some muscle mass and increase my core strength, now my hip and lower back pain is much better.
That's great.
But I think it's really interesting how, going back to the conversation about trust, stability, stuff like that, might lead to a dysfunctional pelvic area.
Yeah.
The times, from what I recall, I'm pretty sure that the specific times that I have experienced a lot of hip pain and couldn't get to the bottom of it,
Mhm.
those times were usually the most unstable,
Mm.
um, just times in my life
In
where
life, yeah.
I didn't feel safe
Mhm.
where I was at. So
Mhm.
that makes a lot of sense why that.
Security too is another piece as well.
What about the sacral chakra?
Yeah,
So there's
yeah.
the root and then the
Yes.
sacral is like right above
Mhm,
it, right?
mhm. Yep.
Okay.
Yeah, the sacral chakra being like the womb space or
Yeah.
like the reproductive tract, like that area. Those two are very connected. So in terms of our ability to, and then if you even think of the solar plexus chakra, which is higher up from there, that's like our
Yeah.
radar system. That's like scanning the environment. We're walking around, we're picking up on things. The thing is how tapped in we
And
are to
that's where
these
that
different chakras.
diaphragmatic breathing helps because
Mhm.
I didn't realize it, but I do diaphragmatic breathing all the time because it's my solar plexus area that I
Yeah.
think is now my problem area that I
Mm.
have to check in with a lot. And
Mhm.
I just think that it's because I'm
Mhm.
have in a very like high energy
Mhm.
place in my
Mhm.
life. But I'm really just glad that I'm aware of it because a lot of people are not aware and they
Yes. Just that it exists.
yeah, and then eventually they get so far down the road
Mhm.
that it's things start to hurt or
Yeah.
things start to go wrong.
Yeah.
And then they're like, "How wait a second, how do I reverse all this?"
Well, the thing is it's always a continuous process of checking in. So that's some of what I was just having this conversation this morning too, but um when we think about, even if I think about the story I shared earlier, right, having vertigo. There were many years where I thought of, okay, this is my story, this is my why, and it still is a large part of my why. Um, but we grow and we change and we reassess and we look at things again. And so if we think of our bodies in terms of we're maintaining, but we're also preventing, future things. Um, we're never a finished product, both in terms of growth or also in terms of physicality too, because there's always going to be different environmental changes that are happening, right? Your body every 7 years changes over all its cells, and so you're like really biologically different than you were 7 years ago, and then different than when you were a child, right? Or different at different times of your life. Um, but that being said, then when we think about it in terms of the chakras, when you check in with different parts of your body, if you're not necessarily aware, like you said before, of that these chakras exist, that these energy centers exist, that can also be, confusing in and of itself. Then maybe now you're aware of it because this podcast is happening and you're learning about it. When we're checking in with these parts or with these parts of the body, one thing I'd recommend to people, and that I need to do myself too, is to see, are you aligning? Are you living with balance in these parts? So in terms of looking at the solar plexus in particular, that one scans and is like a radar for what's around you. If what's around you is so disconcerting, uncomfortable, and not something you agree or align with, your blip is going to be going on boop, 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 all day. That eventually there'll be an imbalance because your body's not listening to that, similar to the root chakra, right? And I think a lot of people do dissociate from this area of the body because maybe they've made choices or there's, non-consensual things that happened in that area. I see and hear that a lot with medical things as well. That maybe they had a procedure. I can't tell you how many patients I've worked with who said, "Oh, I completely forgot I had this done." And then after that, actually, I started having pain, or there's different things that have happened to that part of the body. Though, if you're not listening to what's happening or what these chakras might be telling you, if you're not tuned in or tapped into that, and that's what's the continuous process, is you have to continuously listen to your body. It's not like we check in, okay, we're good, now we're good, this is balanced, now I'm going to go on the next 10 years of my life. That's not how it works.
Yeah.
And
And
we have to always go back.
you can't just listen, you have to honor and,
Yes.
kind of be the protector of that body, right?
Mhm.
Like earlier when you're talking about how you sometimes you would talk to patients and they would say yes, but their body would be
Yes.
saying no.
Yes.
And in a way, that's like a form of self-betrayal too.
Yes.
So when I hear trust, betrayal issues, instability, There's a lot of outside factors that could affect your ability to trust. But it's also like, what are we doing to maintain our self trust and to
Mhm.
not betray ourselves?
Mhm.
I think there's a lot of opportunities for us to betray
Mhm.
ourselves every single day.
Mhm.
Um, and, I think that's just the whole like name of the game of it is if
Mhm.
you can not only draw the line in the sand of this is my boundary, but also love yourself enough to honor it.
Mhm.
That's the hard part.
And if you can reframe it, like let's say, if someone's in a job that they're not aligned with, or they feel, I don't 100% agree with what's happening or this or that, how can you reframe it, right? I'm learning this from this role, or I think of that all the time because people have shared it with me, if they have a manager they don't like or something. You're learning what type of management styles you do or don't align with. You're learning what you would want to create if you had your own business or your own space. You're learning the type of compassion that you want to receive from others, and what you put out there is sometimes what you get back. So in terms of looking at your space, how can you reframe things? Of course, if there's non-consensual things happening, or like in the case of abuse and all that. I've also heard stories like that too, where individuals are in situations where, they decided, well, my pain went away or stopped once this partner and I were no longer together. I've heard stories like that too. And sometimes people stay in a situation and their body is telling them no, but they're still choosing that situation. So those are things that the body will manifest to a degree. But I'm always careful too, both as a clinician and as a yoga teacher, to say that, we don't want to be that hard on ourselves at the same time. And I know we were talking about psychosomatics and somatic um, manifestations before too, but I've experienced before myself when I had vertigo, for example, that for many years I went down the rabbit hole of what could I have done? Is this trauma that I haven't resolved? Is this stress that I haven't? And I think that for someone who's like hard on themselves or who's like a perfectionist, like I kind of have a tendency to be too, that like you don't want to add that into another list of, okay, let's add it to the list of ways that Rebecca is hard on herself, right? You want to kind of still give yourself that grace and still allow yourself to say that sometimes things just happen. And can we look into that a little bit? Yes, but how helpful is it to just continue to go on and on about the same thing? I worked with Michael Scrow, who was one of your guests, and I know we spoke a bit about that as well. But he and I spoke a lot about a wheel or a tire in the mud, right? How long is that tire just going to keep spinning in the mud
Hmm.
before then you
Absolutely.
help it get out of the mud and now you can actually get on with things,
Yeah.
right?
Some
So,
things you're never going to be able to change.
mhm.
And I think if you are one of those people, like I super relate to that, I've been very fortunate to have not had any major health issues. But I know that I would be one of those people that would be like, what did I do to cause this? Because my first reaction always when bad things happen is, what did I do to cause this? Just simply because I'm take extreme ownership over things. And within reason, that's a very great trait for people to have is, oh, you take full responsibility for your life. That's wonderful, but don't allow yourself to just go off the
Deep
rails.
breath there for you, girlfriend.
Yeah.
Really, I feel you on
I'm
that.
like
I feel you
lucky.
on that. But yes, so it's a blessing, but it's also, I don't want to say a curse because it's not like a curse, but it's also, it's tender territory, right? Because it can also be really easy to just add on or tack on, for myself anyway, tack on another thing. And so thinking about like life history, life journey, when I was pregnant, I was super ill and depressed. Totally unexpected, hit me like a big slap in the face. Not in like a way that I wasn't expecting it. I thought I would be, be uncomfortable during the pregnancy, had no idea how depressed I was. So now I'm a huge advocate for, like, I have prenatal yoga class series that I try to generate community in that space, because I remember what it was like and how alone I felt during that time. And I had lots of friends who I reached out to, but I think the depths of how low I got, I didn't even know that I could ever get to that point. And it's like when you're there, sometimes if you're like at the bottom of a hole or a pit or whatever, you almost don't even know, is anybody up there who could like help me out of this, so to speak. So when I think of that in like the prenatal or pregnancy space and then postpartum, I think it gave me that too. I've reframed so much in the sense of it's given me insight into being able to tap into and meet people where they're at when they're super low. And I think that, like, from a very spiritual standpoint, if you've seen a lot of darkness, if you've seen a lot of like shit, um, people will find you, like gravitate to working with you, sometimes without even knowing how dark you've seen yourself individually. So I love to like hold that space without necessarily telling my story to patients or clients that I work with. And so down the road at some point in my life, I could see myself being like a death doula or something like that, because just seeing that darkness, like understanding it, holding that space, and so that's another thing that I feel responsible for in a positive way when I'm working with someone, is to hold that space, the dark, the light, everything in between.
I love it. I feel like just hearing you talk about all this, in my head, I'm thinking of all the people that I need to connect you with, although I'm sure you're connected with most of them because that's just how
Some of
Syracuse is.
them. Yeah.
But are there any other, you know, any other practitioners or professionals in a parallel industry, if you will, that you like to collaborate with or have partnered with in the past?
So one in particular is Alicia Murray. She's a mental health counselor. She has a wonderful practice. I've also collaborated with Lauren Ippoliti, who does imago therapy here. So we've like co-treated lots of patients. There's a few integrative medicine doctors in the area. So Kaushal Nanavati, I've collaborated a lot and worked with. So he's a medical doctor. Dr. Susan Stone is another who's also a medical provider. I've seen a lot of her gut health patients. She sends me patients. We send each other patients back and forth all the time.
I'm sure gut health and pelvic health
Yes,
are,
yes, yes, yes. And we've been told by a lot of patients too that we're like the dream team. Like you see
yeah.
both of us and your symptoms will resolve. And she owns Willow Health. Um, and then there's other lots of yoga teachers who I've collaborated with. And yeah, so
Okay.
there's a whole lot more that like I don't even know how to start
There's so many.
explaining.
There's so
Yeah,
many incredible people
there really
like
are.
doing their own thing
Mhm.
here, that are
Mhm.
all super passionate about
Mhm.
helping people. So I will, when we're done recording, I'll be sure to just chat with you about a few people I think
Yeah.
you should connect with.
Thank you.
What else is coming up in 2025 and outside of the incredible programs you have going on in May and June?
Great question. So toward the end of the year, I have a virtual training program that I'm working on for pelvic health. So we are doing an in-person training happening at Center of Om, like I mentioned, the one in Baldwinsville. That's happening in June the 7th and 8th. I'm also launching a virtual version of that. So a lot of people have asked me, they'd say I work full time or I can't make it that weekend. So I am working on a virtual aspect of that. It's going to be larger, it'll be longer. It's 10 hours we're doing in June. It's going to be 20 hours of yoga teacher training. So that is something that I'm launching at the end of the year. I also take virtual yoga students and virtual physical therapy clients as well. So seeing those and continuing. Yeah.
You're doing all the things. So
Yeah.
this course that you're going to be, this virtual course, is it going to
Mhm.
be like an evergreen sort of thing where people
Yes.
can
Yes,
take it when they're
it
ready?
will. Yep, yeah, thanks for asking, and then it's also going to be, like, coaching will be available through that, so, like, if someone really wants that one-on-one and wants to understand a little bit more about some of the cases that they're working with or students that they're working with or anything like that. It's also gonna be designed for clinicians and yoga teachers as well, so it'll be similar in that way to what we're doing in June. What we're doing in June, of course, it's like in person. And so for me, I after like going through COVID and doing all the virtual stuff, I love the in person, like personally, but virtual, there's a place for that as well. Right. And so I can expand beyond central New York. Long term goals are really to own a yoga studio and clinical practice combined and have a number of those really across the country. So that's
Yeah,
my idea.
really niching down
Yeah.
into the pelvic floor
Yes.
yoga.
Yep.
I love it.
Mhm.
I think there's definitely a space for that. And I also think just you know, envisioning the classes and your clientele, I think that
Mhm.
that'll be a really amazing way to create community for women that are
Mhm.
sharing similar experiences,
Yeah.
especially something so vulnerable. So
Mhm.
that's really important stuff. So I'm so grateful
Thank
to have you in
you.
Central New
Yeah.
York, first and
Yes.
foremost, but I'm sure you're going to spread your wings and do some awesome stuff across the whole country.
Yeah. Well, this is really like this place is such a it's a birthplace, it's a breeding ground of entrepreneurs and ideas. And that was something that I loved when coming to this area was just I couldn't believe how collaborative and helpful people were within one another. I mean, the networks that I created in multiple different avenues just from being here. It's like you meet one person and you meet 10 people. And then, especially those that are oriented like we are toward networking, you're able to tap into so much and because we do more together. I don't know who's credited with this quote, but if you want to go fast, go alone, but if you want to go further, go together. And I love that because that's how I think of it in terms of the pelvic health space too. Many people have asked, you've been practicing in this for a number of years. Now there's way more clinicians. What do you think about that? Right. And so even if someone comes to me and I'm not like the clinician for them, I'm like, let me tap you into like all these other clinicians who could help. Maybe you'll resonate with one of those or go to one that takes insurance and things like that. I look at it in terms of, there's so many people that we can work with and help.
Oh, yeah.
So let's just all do it together.
Yeah. I'm a firm believer that as long as are staying authentic and working your tail off, you're going to attract the people that are for you, right?
Yes.
And like the most successful people are always the most generous. If you just operate from a service focused place where all you want to do is just help people,
Yeah.
whether you are
Yeah.
or aren't the person for
Mhm.
them, that's what this world needs
It
more of.
gels. Yeah, it definitely does. Yeah, you're
So
like in the
regardless,
flow.
there's
Mhm.
you won't ever have to worry about competition if that's how you are because you're always going to be successful
Yeah.
whatever you end up doing.
Yeah.
And you
Thank
participate
you.
in some case studies too, right? Where you're kind of working with other people that would be considered a competitor, but
Mhm.
you have that collaborative
Mhm.
spirit.
Yes. Yeah. Yeah, there's others who I've shared a lot of patience with. When others are on maternity leave or something, we kind of have you worked with this individual, if you tried this. I'm the only one in the area who has a yoga background of the pelvic health clinician. So, but that's a part of why I'm training others because I'm like, okay, I'm not scared. Let's talk about these skills. Let's talk about how to apply these so that you can be better suited to work with patients and to help them using yoga. And, because it's such a helpful thing, it's really like train the trainer. That's really my approach is like, I feel like I'm at that space right now where I'm like an expert in this niche area. How can we train the trainers so that more people can do this type of thing with others? So I love it. There's a couple of physical therapists now who are working within the yoga space too, on pelvic health, and there's trainings. Kathleen Frizzy is doing one with a physical therapist. And so there's a number of people who are talking about it. And I think, again, it's just helping that consciousness to rise. It's very different than when I first started talking about this at the Southwest YMCA, and two people attended, and we were talking about the pelvic floor, and no one knew what it was. We've come a long way since then.
Yeah. Have you ever thought about starting your own podcast?
No, but I did I did an Instagram live, like, during COVID, I did a stint where I was interviewing people. I loved it, but
Yeah.
then time just kind of, like, took its,
Yeah. Well, the
so
thing is, within the space that you're in, I would assume that it would require a lot of educating. Part of the job
Mhm.
is
Yes.
educating
There's so
people,
much to talk
right?
about.
And especially if you are trying to spread more awareness, having that educational strategy is
Mhm.
probably key. So, yeah, if you ever have any questions about starting a podcast, let me
Thank
know. I
you.
think you'd be great
Thank
at it.
you. Thank you. Because the other thing too is, oh man, there's pelvic floor podcasts, and it's funny. It's like some of them are like I love opinions, so like I'm totally
Mhm.
good with that. But there's some clinicians who are like sometimes they get so opinionated on this. I'm like, I don't know, I could eat it right up. Like
Yeah.
I'll just do opinions all day. So
Yeah.
I don't know if it's in the New Yorker in me. I'm from Long Island,
Yep.
Queens area. So, but I'm like
You're not afraid to be a
all
little
about it. I'm
controversial.
not afraid of that. And also, I think this stuff requires advocacy. It requires pushing the envelope. It requires going next level. So
Yeah. Yeah.
that's where I'm at.
Yeah,
Yeah,
you have
I
to
get
be a
fired up.
disruptor to succeed, I think, in something like this. But
Yes.
you're doing amazing. You're
Thank you.
certainly playing the part, and I look forward to seeing everything that you accomplish in 2025.
Thank you.
It was a pleasure.
Thanks for
Thank
having
you,
me.
Dr. Rebecca Alexander Carey. Everybody, give her a follow on social media. We'll be sure to add all the links in the show notes.
Thank you.
And if you're interested in checking out her programs, we'll have links for those too.
Great.
Thanks.
Thank you.
All right, guys, that's it for this week's episode. Thank you so much for tuning in to Cultivate CNY. If you enjoyed this episode, I'd love it if you left us a review and make sure you're subscribed to the show. Speaking of the show, if you or someone you know wants to be our next guest on Cultivate CNY, you can submit an application. Just click the link in the show notes and we'll be in touch soon. If you're a business owner that's interested in getting in front of our audience and would like to find out more about sponsorship or advertising opportunities, shoot us an email at podcast@cnywomensnetwork.com. We'd love to work with you. All right, that's it for now. We will catch you next Monday.